What are the different types of manual therapy and what are the best ones for your patients? Hi, I'm Dr. Michael Lee, founder here at The One Method. Thank you so much for joining me today. If you're a physio, chiro, doctor, sports therapist, let me know in the chat because this one is for you. Because you're probably actually thinking, I know all the manual therapies because that's my profession. That's what I'll be doing. I'm a chiropractor, I adjust, I manipulate, I know what to do. I'm an osteopath. Oh yeah, I work on soft tissue. I'm looking at fascia. I'm a sports therapist. I'm actually doing massages every single day. But the real question is, which one is best for your patients? Well, ultimately, I need to ask you a simple question. Have you ever got a patient that you've struggled with? That you thought, actually, I've been doing the thing that I know, but they're not getting any better. Or even worse, they have to keep coming back because their problem and their pain just keeps coming back. Because you know what? If you're getting those types of outcomes, guess what's happening? You are treating the symptoms and not the cause. But yeah, I get it. Good for a business plan because you get return custom. But in terms of if you truly want to help patients, you have to find the cause. You have to find out what is causing this problem. Because you don't find a cause, it just keeps coming back over and over and over and over again. Because I know some of you, we do have clinicians that are also acupuncturists, and I'll probably put it in to the same category of manual therapy, because although not structurally like changing things, but of course the needle itself will make changes to the musculoskeletal system as well. But as we go forward into actually thinking about patients, the ones that are struggling or in pain that you can't fix, or they keep coming back to keep getting manipulated or massaged, we have to firstly ask yourself, what's the purpose of certain manual therapies? So let's start with massage, for example. Massage, and I'm going to strictly say this exclusively, if you are massaging to get rid of a tight muscle, you might as well give up now. The reason why is, just think about it. You battering a muscle and it's tight, how soon does it get tight again after that? Straight away, because you're not actually treating the cause. Because that's the question. When something's tight, why is it tight? Does the muscle have its own mind, its own brain, just, I'm just going to feel like being tight today? No. The brain needs to send a signal for the muscle to contract and not relax, and we call that hypertonicity. It's hypertonic. So if you keep battering, yeah, it might relax for a few minutes because you've given the stimulus, but then again, it becomes hypertonic again anyway, probably within an hour or two, just because the brain has to switch it back on. But we need to find out why is it actually doing that. So if you're doing massage to release things, forget it. You ain't going to release anything because you just come back anyway, because it's the brain that has made it brace in the first place. If you ain't going to change anything up here, you ain't going to change anything in the body. However, if you are exclusively doing massage, Graston, trigger point, all those types of things, right, to break down scar tissue, now that's a whole nother ballgame, because if you did it to break scar tissue, then yes, congratulations. That is the main function of massage. Myofascial release, trigger pointing, yeah, is to break down Graston tank. They're the things to break down scar tissue. So if you are doing it to break down scar tissue, great, please do it, because that's what that type of patient needs. If it's tightness, forget it, because you'll be there, you'll be putting all this blood, sweat and tears, all this energy into try to release this muscle. It just keeps coming back anyway. It keeps coming back. And sometimes your patient will go, oh, it feels great. It keeps going right. And they come back later, maybe next week or a few days later. It's back to how it was before. And we see it so many times because so many clinicians don't ask the question, why? Why does that actually happen? Why does it get tight again? Why is the brain creating it? Because they're so focused on the body to forget the cause, they forget the big picture. The other thing is this. Manipulations. Yeah, I used to manipulate loads, but I don't mean to so much anymore. Because when you manipulate something, yeah, you're adjusting, you're realigning joints. Joints may get stiff, they may get jammed, they may get stuck. Yeah, manipulate it. How soon does it get jammed up again? Again, a few hours, maybe a day, maybe. Because ultimately, you can manipulate something, but if you don't look at what's holding it in its correct place, the muscles, and if you're not looking at what's making the muscles operate normally to contract and relax, it's the nervous system. And if you're not looking at what looks after the nervous system, which is the brain, you failed anyway. So this is why here at The One Method, we look at the big picture. We find out exactly what is it for. So the whole function of adjustment or manipulation, yes, if something stiff, if something is jammed up, if something is immobile, manipulate it. But is it a long-term treatment? No. Because you still need to find out the cause. Why is it being jammed up? Why is it being stiff all the time? Let's find out what can we do to improve it. Okay? So you also got the things like acupuncture. Same thing. Put a needle in, right? Twist it, put electrodes on it, moxibustion, whatever you want to do. Ultimately, yeah, guess what? Once you finish treatment, it gets tight again. Because the brain has to switch on the muscle. And why? Generally, what we find, the brain always switches on the muscles because other muscles are not working. So it's the compensation. It's doing the job with the other muscles that are just not firing. So if you find out the ones that are not firing, get them working, guess what? The ones that are tight or always on don't need to be on so much. It can just focus on its own job. Then it doesn't need to focus on any other muscle's job. And generally, these are the muscles that go over more than one joint, because if it's more than one joint, you can have more than one function. If it's over one joint, generally it's one function. So this is where we need to find out what's actually happening in the body. But ultimately, we always need to check the neurology. When I was teaching in the Philippines a few weeks ago, we had 1,300 clinicians in the room. I asked them, when you give a patient an exercise, did you even check if the nerve to that muscle even works? And guess what? Complete silence. No checks. Why does no one check? This is the most important thing. Let's say, for example, the nerve to the muscle doesn't work. That means the muscle will never fire, right? What will happen is that the patient will just copy the clinician's movements to get the right muscle working. But because it doesn't work anyway, they're going to use other muscles to compensate. And what happens is all you do is actually strengthen their compensation, which will break down eventually anyway because overloading and overworking. Does that make sense? So we need to find out, why is that actually happening? Because if you don't find out the why, you'll be chasing your tail over and over and over and over and over and over again. Because everything starts in the brain. The brain creates everything, right? Every dysfunction, the brain knows about. It's not, it doesn't know what's happening. It knows exactly what's happening because it created it. You need to find out why it created it. And this is why on the one method, we have the N part of the one method is neurology, because it's actually one of the three pillars that actually we look at to make sure that everything is operating at its best in a patient's system. If we took away neurology, actually, it doesn't work. If we took out the E, which is the psychology, the emotion, it wouldn't work. If it's the O, which is the orthopedics, how the body moves in biomechanics, again, the system won't work. We need all three of them to make sure that everything is working perfectly. So I really hope that this is making sense to you. But if you've got any questions, put them in the comments, because yes, there are lots of treatments out there. And the great thing about the one method is, it's my own experience. I've created it out of completing 7 degrees in different specialisms, from manipulation, doing manual therapy, doing injections, prescribing medicine, to doing acupuncture, Chinese medicine, Western medicine, biomechanics, sports science, nutrition, psychology, all these different things. Put them all into one place, because 80% what I learned treats symptoms, doesn't help the patient in the long term, and only the 20% which I teach here as a one method, that's the truth in terms of what can help really get to the root cause of the problem, but also tie everything together to help patients operate at their best anytime, anywhere, in any environment. So if you want to learn more about the one method, please let me know in a comment. Just put me in the chat. One of our advisors will actually ask you, because we don't invite everyone, but the thing is, we want to find out what you want to learn and why you want to learn it. Because if we find the right clinicians, because ultimately the ones who are the right clinicians that do the one method, these are the ones that are going to change the world in terms of how treatment is being given, but also how patients get instant changes. We don't have to wait, because neurology changes instantly, right? We can change how the brain responds very, very quickly. So thank you so much for joining me today. Other than that, see you next Wednesday, and have a good week. Bye for now.